So basically, we need to start our mock interview. So that's just
Yes,
an interview to like get some kind of information from our students and what kind of a communication skills do they have and what they have
yes,
basically learned from our medical billing course. So that is only that kind
ex
of a stuff. So
exactly, exactly.
my first question to you, as always,
Yes.
everyone just go with this one. So can you please introduce yourself?
Yes, I am Dr. Zafar Aziz. I've been a medical graduate from King Edward Medical College, and I was a government servant, and also I worked in the World Health Organization, which is a part of United Nations, as you know. And then I became a teacher for medical students, and I used to teach in a medical college. Just recently, I left this job, and I've now sort of entered into this field, and I'm trying to sort of build my career in this field. And I would love to be a part of your team and learn these new things because I realize that this is a very big field and
Right.
it has a very good future and there is a lot of working which we can do in it. Since this there is another also factor. Since I was a doctor and I've done a lot of medical practice and other things, so this thing being a new one, and
Mhm.
also I feel that this has a very big horizon and it has a lot of dimensions. For instance, there is a part of medical coding, then there is a
Right.
part of medical billing, and then there is a you get interaction with the doctors and so many other people, and you enrich your knowledge and experience. And also, then there is a source of income also. And as I was telling you, that this is a field, I was really astonished because I went through certain PDF documents of this medical billing,
Mhm.
and I saw that this is a field which is growing at the minimum pace of 6% per annum, and it will grow for many years to come because it is sort of a specialized field, and then there is a lot of learning which is required in this field, and it is sort of a technical field which everybody cannot adapt to, and also everybody don't likes it.
Right.
Yeah. So this is said my uh,
A
simple.
brief introduction to myself.
Yeah. Thank you very much.
No
I'm
problem,
really
sir.
thank
Okay,
you, sir.
so my next question about medical billing is going to be like, can you please explain what is the coordination of benefits? COB.
Coordination of benefit, yes. When, for instance, when a medical situation arises,
Mhm.
and then a person who is in agreement with the insurance companies, different insurance companies, he has to get benefits. He tries to rather get benefits from both of them. But
Mhm.
the thing is that according to the agreement, the first insurance company will pay him according to its own agreements and beliefs. Whereas the things which they will not pay and the remaining things can be paid by the secondary insurance company.
Okay, perfect. Okay, so my next question to you is going to be like, what is the significance of modifiers in medical coding?
Well, the thing is then, for instance, a service is rendered by a provider to patient. Uh, it is it is transformed into a code,
Right.
medical code. For instance, for diagnosis, we will go for ICD-11, as you said in your lectures,
Mhm.
and then we will also then go for current procedural terminologies, and then HIPAA also for other durable medical equipments. And like this, we will go for the codings. But the thing is that, for instance, uh, a, service which has been rendered
Hmm.
uh, is one entity,
Right.
is is uh, is one entity, and the modifier is which adds to the basic service rendered.
Okay, perfect. Okay, so thank you so much for this answer. My next question to you is going to be like, what is the difference between pre-authorization and a referral?
Well, sir, the referral is given by the primary care physician,
Hmm.
and this is the referral which is required according by this some HMO, like health maintenance organization,
Hmm.
which is required. And the other thing, sir, you asked was
Pre,
one is this the pre-authorization.
right,
Pre-authorization is an authorization which will be required to the patient by insurance company whether this service can be provided to him or not. So this prior authorization is a must if he wants to get this. Without this authorization, if he gets this service, it will not be he cannot claim it.
yeah, perfect. Okay, my last question to you is going to be a little bit about some abbreviations. So can you please let me know the abbreviation of HIPAA?
HIPAA is this Health Insurance Portability and Accountability Act. It was established in 1996, and this is meant for the secrecy of the patient. And since the medical records, according to the law, they cannot be shared to everyone, and this is a sort of only the knowledge which is a secret uh, for the patient and with the provider. This cannot be shared with everyone.
Right.
It is a entity which for which the patient owns sort of rights.
Hmm.
Nobody can disturb his rights of secret medical information about him.
Okay,
So this
perfect.
is a
Okay,
yes, sir.
thank you so much, sir. I really appreciate the way you just provided all the answers, and I had really had a good time with you. And this was my one of my best interview with my students. So I really appreciate and have a good conversation with you.
Okay.
And one more thing, I just need
Uh,
to ask, how did you like? Did you get something beneficial from this medical billing course?
yes, even I am a doctor. I am an MBBS doctor, and I am also a postgraduate in preventive health. Uh, the thing is that this is a different dimension of knowledge, and for मतलब कि you cannot be मतलब master of everything.
Right.
Eh, So this is a different dimension, and that's why I have a lot of respect for you, and I really appreciate you, and I love to be with you and work
Inshallah.
with you, and maybe on the net we can inshallah ta'ala work, and maybe inshallah ta'ala I can without any payment I can give you this medical coding and other things also inshallah ta'ala, and
Inshallah.
I will inshallah ta'ala again inshallah ta'ala this I think is an opportunity for me to learn. And
Hmm.
this course, I think this is an ABC of to start with.
Right.
So for us to go to Z, XYZ, it will take some more mileage
More
and
time.
more
Right.
more time and journey.
Yeah, of course. This
And
was
really,
basically the basic course.
and,
So how you can just
yes,
understand what is basically medical billing and how you can just enter into
yes,
this
yes,
basic field.
yes,
So these were the
yes, yes.
basic kind of a
And
stuff.
yeah, and also I think this is a very interesting
Hmm.
thing since and you also must be going through this process that every patient is a new one
Right.
and every case is a new one. So so every case is a new interesting thing. Because when I used to take history of patients, so every patient is a different person and human being, and he has a different altogether history and picture and whatever. So like this in medical coding also, when the you process these claims and cases, every case is a different one.
Right.
If you have, for instance, since I am a medical doctor and I have this medical knowledge. So for me, this is altogether more interesting to see more and more cases and new cases and things like this, because this is a dimension which will interest me more than anybody else. This medical part, and whereas the medical billing, that is, yes, that is a routine thing. But for
Okay.
me,
Hmm.
to learn and to see the new medical cases and histories, and this is a new thing, and this is
Okay.
an interesting thing. Well,
Okay.
it is an interesting thing.
Okay, okay. Thank you
So,
so much, sir. I really appreciate your time, and you just gave us some precious time, and it was really nice to see you and have a good conversation with you. And thank you so much once again. So this is all about our mock interview, and inshallah, I will get back to you about your marks in this one as well, and hopefully you will be receiving a good certificate from us as well.
I'm really grateful to you, and really thankful to you, and I really appreciate your inputs and the good method of teaching you have. And
Thank you.
really, this is because of Alhamdulillah, the rich knowledge you have gathered after getting into this field and getting knowledge. And this cannot be done without conviction
Right.
and conviction and interest and motivation. So the motivation, Alhamdulillah, you have is something which should be followed by your students. So actually, this was my interest, and sort of it pulled me like a magnet
Hmm.
towards it, because it involves this medical coding. So
Hmm.
I was interested in this, and this is the reason that I have tried to learn and become your shagird. And so,
My player, sir. My
so,
player.
so no, no, it's really, like, there is no doubt that you are our teacher, although you are, I think, less in age than I am. And but the thing is that you are my mentor, and I really enjoyed it learning. And the other thing is that what I am impressed about you is that you have a very zabardast type of motivation, and you also put a lot of motivation into your students also.
Hmm.
But the thing is that since at the start we are about 37, we were 37, and
Right.
in the end now I think we are only 12. So this also tells about the interest the people they have, and also it tells that who can carry on with you, who can pull on with you. And this also tells about, this is also a sort of filter. Time is a filter which tells you that certain people who are very motivated, they will remain with you, and otherwise the rest will go away. Since joining this course, I learned many things from you, and and this is a continuous sort of process. The learning process is always, even I think you are also learning many new things,
Of course.
and yes. So and I am also of the conviction that Alhamdulillah, we keep on learning, and this is from birth to till death, that this
Yes.
process keeps on going. The knowledge is so much that Almighty Allah Ta'ala has only given a few drops to us, but even then, they are like big sea and big rivers which we cannot take in.
Yeah,
So
basically
I
life
really
is
appreciate.
always exploring and learning.
Yes, yes, yes. And I really appreciate, and I love to hear you, and also
Jazakallah.
your motivation. And I can very well understand that in the start you were just like a student like us, but with the passage of time you have learned after interaction with the different people. abroad and over here also, you have learned so many, and you have, although I think like maybe you are not a doctor, but
Right.
even then you have a very rich knowledge, which is I think beyond some people, and
Actually,
this is
I
only.
sorry to interrupt you. Basically, I did my BS in biotechnology. So that's why I have a good information and knowledge regarding medical billing stuff. Basically, I also tried to appear in medical exam as well, basically twice.
Mashallah.
Yes, yeah.
अच्छा
Then
अच्छा.
yeah, later on, then I just moved to my professional career in medical billing. So that was the main
That
reason. Yeah, we were having a lot of stuff in medical billing and little bit knowledge as well, like what is medical billing and what are the different medical terminologies and all that kind of a stuff.
May Alhamdulillah, with the grace of Almighty Allah, you are very much learned now. And but the thing is that we as the human beings, we keep on learning,
Yeah, of
and
course, definitely.
always. And I am of this conviction that we should keep on learning, and also this will keep you young also.
Inshallah, sir, inshallah.
If you will keep on learning, it will keep you alive, live, and young also.
Inshallah, 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 inshallah. Okay, sir. Now it's time to say goodbye and thank you so much once again. So see you inshallah next time. Take care. Have a good day and have a good night as well. See you. Take care. Allah Hafiz.
Thank you very much, sir. Nice
You're
of
welcome.
you.
Thank you so much. Allah Hafiz.